Hey everyone, thanks for taking a look at my poster. My name is Stephen Breazeale, and I'm a third-year PhD candidate at Yale School of Nursing. I will be presenting some preliminary results from my F31 funded dissertation entitled Symptom Cluster Profiles Following Traumatic Orthopedic Injuries. First, a quick introduction. Each year, millions of Americans experience traumatic orthopedic injuries, or TOIs, with many going on to experience symptoms of anxiety, depression, pain, sleep disturbance, and stressor-related disorders. The regulation of a protein called brain-derived neurotrophic factor, or BDNF, may contribute to the ways in which TOI survivors experience post-injury symptoms. By sorting individuals into groups called symptom cluster profiles, we can examine potential biobehavioral mechanisms responsible for symptom development and identify those at highest risk for negative outcomes. Our specific aims are to describe TOI survivors' group membership in symptom cluster profiles, to examine the associations between demographic and clinical factors in symptom cluster profile membership, and to test the hypothesis that low serum concentrations of BDNF and BDNF genotype are associated with symptom cluster profile membership. We are using a cross-sectional design with 150 participants. We are using PROMIS short forms to assess for symptoms of anxiety, depression, pain, and sleep disturbance, as well as the acute stress disorder scale to assess for symptoms of acute stress disorder. We are collecting whole blood from all of our participants to examine serum BDNF concentrations and BDNF genotypes. TOI survivors are eligible if they are aged 18 years or older, or within 72 hours of their injuries, and have a fracture to the appendicular skeleton or pelvic ring. For aim 1, we are using latent profile analysis to identify the symptom cluster profiles. We are then using multinomial logistic regression, ANOVA and Kruskal-Wallis tests, as well as genotypic association tests to examine the associations of the biobehavioral covariates with symptom cluster profile membership. To illustrate our main goal in aim 1, we will be sorting a heterogeneous group of TOI survivors into homogeneous groups based on their collective symptoms experiences. We are then examining potential reasons for symptom cluster profile membership in aims 2 through 4. Preliminary analysis of the first 74 participants reveals that, like many other trauma populations, our sample skews young and male. Our sample is mostly white and non-Hispanic, but resembles the demographics of the state of Connecticut. Most of our sample has health insurance, whether private or publicly funded, and has at least a high school education. Most participants were injured via falls or motor vehicle collisions, had 1 or 2 fractures, and presented with labs within normal limits. Most injuries occurred in the pelvis or lower extremities, and most participants had only injuries to one extremity. Finally, our sample reported experiencing extremely high levels of symptoms of anxiety, pain, and sleep disturbance. Roughly 18% of our sample reported experiencing higher levels of acute stress disorder, which is more than the general population, though not as severe as the anxiety, pain, and sleep disturbance they report. Interestingly, our sample did not report experiencing depressive symptoms more often than the general population. These findings are promising for our final analysis. Thanks for watching, and feel free to reach out if you have any questions. Thanks.